Hi everyone, this is Netra Srinivasan. I'm founder and president of the NeuroKids. And today we're going to be talking about mood disorders and disorders of cognition. So welcome. So here is our agenda. As I mentioned before, we're going to learn both about mood disorders and learn about disorders of cognition. These are two very important types of um, psychological disorders, which are important to know for the brain bee as well as just life in general. So, first of all, what is mood? Mood is a vague term describing a person's general state of mind. Moods change frequently with emotional state, and it's also in context with our surroundings. So, for example, if you lost something very dear to you, you'd feel sad. If you, for example, got a really nice reward, then you'd feel happy. That's your mood. And this is different than a mood disorder. A mood disorder is when you have mood changes that become longer lasting and independent of what is going on around you. And so, two major types are major depression and bipolar disorder. Another thing to note about mood disorders is that scientists have found genetic links and contributors common to mood disorders and disorders of cognition, which we will go over later in this video. So, firstly, let's talk about major depression. Diagnosis of major depression is having at least 4 of the following symptoms for at least 2 weeks. So, feeling empty or sad, loss of appetite, irritability, problems with sleep, and changes in appetite and weight. And this contributes to disability and death. I want to make one thing clear about major depression. Sadness does not equal depression. If you're sad, that's just a simple mood. It's not a mood disorder because when you feel sad, you usually return back to normal feelings within a couple of hours or even a day. The major depression, it's something that's happening within your brain, chemical changes within your brain, and it's quite long lasting. And it is something that is much more serious and should not be taken lightly, especially when using depression colloquially. Like, for example, I'm so depressed. You're not. You're just sad. And so I want all of you to keep that in mind the next time you use the word I'm depressed. Now back to the topic of exactly what major depression is. Basically, there is activity in parts of the cortex, which is that outer layer of the brain. It's the thin outer layer, which has all the lobes and stuff, and it has activities in parts of the cortex that are related to the limbic system. And if you remember, the limbic system is involved in all sort of emotional things. So that's where major depression comes in. Now, there are treatments for major depression. There are antidepressants, as per its name, and it raises norepinephrine, serotonin, and dopamine levels in nerve synapses. So these help increase your feelings and your activity in general, making you feel happier, more stimulated. So an example is SSRIs, which is selective serotonin reuptake inhibitors. And these basically block serotonin reuptake and they reshape the synapses. So basically, the serotonin keeps is keeping on firing the next neuron. So the levels of the serotonin in the synapses is increased, and it isn't taken up again, and then that lowers the serotonin levels. Another way to treat major depression is cognitive behavioral therapy. So this basically is you sit down with a therapist, and there are specific changes in your thought patterns, and you get rid of dysfunctional thinking to help you get over that major depression. There's also deep brain stimulation. It can relieve intense depressive episodes that were resistant to other forms of treatment. So it's usually used as a last resort. Let's talk about bipolar disorder. This is another mood disorder, and it's different because you experience very intense mood changes. So there's a high episode, which is basically having a maniac episode, and a low mood, which is depressive. You can even be hypomaniac, which is basically being more, it's not exactly maniac, but it's not exactly normal either. It's basically more stimulated, functioning better than normal, feeling better than normal, that sort of thing. So the diagnosis is difficult, and there are no specific tests for bipolar disorder, but it is related to family history of psychosis. So if you are experiencing some symptoms and there's history of psychosis, you may be at risk for having bipolar disorder. But the number one most important thing is to not self-diagnose. You must always go to a doctor to be diagnosed for any sort of disorders. Now, for treatments, it's hard to treat as well. There is medication to lessen the highs and stabilize the lows with the atypical antipsychotics and the antidepressants. There are also anti-epilepsy drugs that have worked, and another notable and unique treatment is lithium. If you know lithium, it's an element, and that's really cool when I learned about it. So right over here is an image of different types of mood disorders. So here's our unipolar depression, which is our major depression in blue. So as you can see here, here's mania, hypomania, and depression. This y-axis is the mood. The x-axis is the length of time. So green is normal. So you can see here, it just ranges in the center area, not too depressed, not too maniacal either. Then, as we talked about the blue, the depression is just slightly high, but then it goes very low into the depression area, and then it slowly gets back up. So you notice there's no really mania periods. But for bipolar 1 and bipolar 2, they dip into depression, and then all of a sudden you increase into mania, then maybe normal again, and then you keep going that way. Then cyclothymia, it's just medium depressed, then going to hypomania, which is between mania and like normal, and then going down and up and down and up into little waves. And so this is a really cool image to think about when we want to compare different types of mood disorders. Okay, now let's move on to disorders of cognition. So the main type is schizophrenia. Schizophrenia is a lifelong psychiatric disorder that seriously disturbs thinking, emotion, and behavior. People say that they lose touch with reality. Now, one thing that we don't want to confuse with schizophrenia is saying that someone with schizophrenia is crazy. That is a mental illness stigma that we want to avoid. And that can also go the other way. If someone isn't behaving the way that you think them to be, you shouldn't call them schizo, because schizophrenia is an extremely serious psychiatric disorder, and it's not that nice to call someone schizo or allude them to having schizophrenia, because that is in no way accurate. Apart from the discussion about stigma on mental illnesses and psychiatric disorders, schizophrenia basically has positive and negative symptoms. So positive symptoms are hallucinations, delusions, and confused thinking, and negative symptoms are inability to experience pleasure, lack of motivation, etc. So schizophrenia usually emerges in the late teens. This is when the development of the prefrontal cortex happens. The prefrontal cortex is involved in planning, higher thinking, etc. And that's where the abnormality in schizophrenia is. This psychiatric disorder is also hereditary. So scientists have found about 100 common genetic misspellings and 11 rare ones in the DNA of schizophrenia patients. Now, there are treatments for schizophrenia. You can have behavioral therapy. There's also chlorpromazine, which was used as an anesthetic, but then it was later employed to calm people down. There are also drugs that dampen the dopamine response. Dopamine is the main neurotransmitter that's involved in driving those positive symptoms. It's way too high in people with schizophrenia. And so basically by dampening the dopamine response, it will help with those symptoms. There are also drugs that suppress serotonergic activity. And they've also found that nicotine helps. It helps relax the rigid nerve cell shapes and functions. So this is why sometimes people, they smoke in order to help with schizophrenia. Smoking's obviously not the best way because there are a lot of bad things, but nicotine that's not in smoking, it could be used as medication, a drug, to help with schizophrenia. Now, these are two images for schizophrenia. So here in the brain, there are these lateral ventricles. In a non-schizophrenic brain, there are these normal lateral ventricles, whereas in a schizophrenic brain, the ventricles are very enlarged. Also, in this image, there is more activity in certain parts of the brain for a schizophrenic patient in comparison to a normal patient. And that is all for today. Today we covered mood disorders, and we covered disorders related to cognition. And the main disorders are major depression, bipolar, and schizophrenia. I hope you enjoyed. If you're watching this on YouTube, please like and subscribe. And I hope you continue to watch our next videos and learn more all about neuroscience. Thank you.